Hey everyone, Bridget here at the AAFE Training Center. We are just doing some filler on my patient. We are actually filling her necklace lines, so I am going directly into the deficit, and I just really obviously stay pretty superficial. I don't need to go deep. I'm really just trying to, hydrate and plump the area. One of her main concerns is her neck. There's a few different treatments you can do, collagen stimulating wise, that look really great in the neck, but she wanted some immediate results, so I decided just to go in with a little bit of filler. I also did her lips, so I used the exact same filler for the necklace lines, except I did add a little bit of saline. Sometimes it can really help to blend down the filler in areas like this where you're wanting to be really superficial, or you're running just like a really small amount of volume, because obviously we're not trying to fill anything here. We're really just trying to soften the lines. We don't really need to give it much volume. So I just kind of diluted it with a little bit of saline. So I made it 1-to-1. So I want to say I had like about a half syringe in her lips, and then I pulled up bacteriostatic saline and I mixed them together. And like I said, basically what this does is it just helps kind of dilute the filler so that it's not as, filling as we would want. So we want it to be pretty light. Again, just trying to hydrate the area. So there's a few different techniques you can do to achieve a good result. You can kind of go above and below necklace lines, meaning like you can make like kind of a sandwich out of them, or you can also just go directly into the line. Hers weren't severe at all. She was just kind of wanting to use up the rest of the filler that we had. So we were really just trying to soften them. So I just went directly into the line. But if somebody has a little bit more severe necklace lines, you can absolutely go kind of above and below the line, and it kind of gives it like double the amount of filling per se that you would want to do. So then there's a few other treatments. You could also do some neurotoxin in the platysmal bands that helps prevent necklace lines from forming. So she usually does have this done, but she hadn't been to me in a good 6-7 months. So we had to kind of start from scratch in the neck. So we didn't end up treating her neck this time, but next time we will absolutely treat it along with her DAOs and mentalis, just to overall help not only the appearance of the jawline, but also help kind of that neck not be able to contract and be able to form those necklace lines. It's really hard nowadays because social media is so big and such a huge part of most people's lives, that we're looking down at our phone. She works from home, so she's staring down at a computer all day, every day. So she just really just developed these lines. And again, like, she looks really great for her age. So she's doing everything right. It just tends to happen as, we kind of start going down the path of aging. So you can see I'm just kind of continuing along. She basically had 2, maybe 3 necklace lines that I was kind of focusing on, but you can see when I have her make that face, it just helps me kind of determine where those lines actually are, as you can't really tell where, when I have her kind of like reaching back, but it looks really nice when it's done. Obviously, the patient's going to be pretty bruised because it's a lot of pokes. Usually they don't bleed too bad because you are so superficial, but usually it does tend to cause some bruising over the next few days. So I always make sure to tell my patient to kind of expect that. So they can use arnica. They can take arnica tablets. I usually will massage afterwards with some arnica gel to really help kind of decrease that bruising and swelling. But like I said, because you're so superficial, they usually don't look too crazy. It's usually like 2 to 3 days after when those bruises start to develop, that they start to, kind of be noticeable. But they can absolutely cover it with makeup or color corrector, or if they are fine with not, then they don't have to. But usually it's resolved within, I'd say 10 days, the bruising is pretty much gone. Like I said, I wouldn't only just do filler in this area. I would do other modalities as well. This was just kind of because we had some filler left over, didn't really have anywhere else that we wanted to put it. So I thought this was a great alternative. But yeah, always make sure that you're kind of diluting the filler or using a really, really, really light filler that's almost just like water. This filler isn't quite like that. It's a little bit thicker. Still really, really versatile, but it is a little bit thicker than like the thinnest fillers out there. So that's why I decided to blend it down a little bit. Some people also do it with lidocaine, which you could do as well, but there's lidocaine already in the filler. So I didn't think that was necessary, but you can absolutely do that as well.